Hello, hello, and welcome to today's episode of Talking All Things Cardiopulm. I am your host, Dr. Rachel Burriesci. So today's episode is titled Wear the Damn Stethoscope. And this episode is inspired by many episodes in my current life that have recently happened. And this is really not necessarily a promotion to wear a stethoscope, although it is, right? Like I am always going to promote wearing a stethoscope. I'm not pressuring you to do that. This episode is really giving awareness of how we present ourselves, how we show up for each other, and what message we're delivering as a profession of physical therapy. So prior to my residency, I will be honest, I never wore a stethoscope. I worked in the acute care setting for about 4 years. I never wore a stethoscope. To be quite honest with you, my auscultating skills were less than subpar. I wasn't doing lung auscultation, heart auscultation, rarely took a manual blood pressure. It just wasn't in my comfort zone. The skills that I learned from my residency, the knowledge that I gained, made me a better clinician for my patients, specifically with cardiac and pulmonary disorders. But it's such an important concept that every patient has heart and lungs. And so if they're in the hospital for a specific reason like surgery, and that surgery doesn't pertain to the heart or lungs, doing auscultation is a perfectly appropriate assessment tool. And it gives you a ton of information. So a lot of times when I'm teaching, I talk about this concept of consolidation. Consolidation is a garbage bag term that means mucus, fluid, or tumor. And there are many assessment techniques like mediate percussion, fremitus, that will basically tell you that there is consolidation present, but it doesn't tell you if it's mucus, fluid, or tumor. Auscultation is one of those techniques that can help tease out and just give you a lot of good information. If I hear rhonchi or coarse wheezes, then I know I have mucus, and I'm going to gear my interventions to breathing exercises that lean towards airway clearance and other specific airway clearance techniques. I can be specific to the segment, the lobe, that has said mucus. If I hear crackles, I'm going to be listening for atelectasis and potential fluid in the alveoli versus pleural effusion at the bases. And then I'm going to gear my breathing exercises to help that specific problem. I might hear diminished breath sounds, which might be something that is expected for a certain population like COPD. Or I might hear it in a post-surgical patient, which is telling me we're not getting good air movement. And I'm going to maybe point my interventions to increase tidal volume. Whatever the situation is, you can get a ton of benefit from auscultating. It gives you a lot of good information. It gives you a specific location. It tells you, the sound tells you what likely is the problem. And the part that I love most about auscultating is the pre-post effect. When I auscultate as an assessment tool, it gives me information. I can then auscultate post-session after I've performed whatever intervention we performed and see if there was change. And it's actually one of the things I love the most about the acute care setting in general, but it's one of the things I love about breathing interventions, coughing interventions. You can literally make a change in that moment. Now, can you be a great physical therapist without auscultating? Yes. Can you be a great acute care therapist without auscultating? Yes. Can you be effective? Yes. You can use other skills to work around auscultation. You can perform good chart reviews, ask great subjective questions, do other assessment techniques to get you to a similar point. But auscultating is more efficient, it's timely, and it's very specific to certain lung and heart issues. So I'm always pro auscultation. I think it's super important to teach those skills and learn those skills. And if you're trying to go in the cardiopulm world, I highly recommend that you find a mentor to help guide you. And we'll talk about that a little bit later. But having a stethoscope can be a great tool. It can give you a lot of information, can be used to perform a manual blood pressure. You don't have to go search for that $2 stethoscope that you can't hear a damn thing with anyway. And in a completely different situation, but just another example, if you have a patient who has an LVAD and they collapse and you have to make a decision about what to do next, one of the things you want to know is that motor running? And auscultating that is just a quick second that you're going to hear that hum or not. And that's going to help lead you to an intervention to help, right? So there are a ton of reasons why auscultation is important and how wearing a stethoscope will basically lead you to those techniques. But my point today was really coming from a different perspective. I always wear a stethoscope 99% of the time. If I'm not wearing it, it's because I left it in my bag and walking back to the office is like a 10-minute adventure. But if I'm treating, I typically have my stethoscope on. And the reason why I wanted to talk about this is really just to bring awareness, because over the past few weeks, I've been stopped about wearing my stethoscope. Sometimes it's completely harmless. Sometimes there's like a little tone attached. And then I have a student who had a very, I'm going to call it annoying. I was a little upset about the episode that she had, but I want to talk about it because it's a big picture problem, or it's a big picture conversation. And that's really where this episode is going today. So maybe a little less on education today and a little bit more on promoting our profession, standing up for ourselves, promoting each other, and educating, right? Because at the end of the day, I think we have a part to play in the whole picture. So last month, I think it was last month, I had two separate scenarios within like a week of each other. And both scenarios, I was like stopped dead in my tracks regarding my stethoscope. So one episode, I was talking with another healthcare professional about a mutual patient. And so she knew I was a physical therapist. Like that was already established. We had a conversation about, it was actually post-session, how she did and my concerns and whatever else. And she asked me, "Are you also a nurse?" With no other context. And I asked, what did she mean? I'm a physical therapist. She knew that already. And she said, "But you wear a stethoscope." I've never seen a PT wear a stethoscope. So this moment, this conversation, this episode was very innocent in nature. There was no tone attached to it. She was thoroughly surprised that I was wearing a stethoscope. No ill intent. And so I let her know that I was a physical therapist, that I specialize in cardiopulm, and I wear a stethoscope every time I treat, and I use it to help make informed decisions about my patient. It was a first for her. That's surprising for me, but it was a first for her. It was an opportunity to educate, and she was really inquiring. But it was also an odd question. Like I was taken off guard. That was the first time I was asked, "Are you also a nurse?" About a week later, I had another episode with another healthcare professional just prior to getting handoff about a mutual patient. We were actually texting on Volt, and we ended up walking into each other. So we were having an in-person conversation. And really, before he gave me any information about the patient, he asked me in a snarky tone, "And what are you going to do with that?" So again, there was no context. He kind of pointed to my neck. And so I just asked, "Excuse me?" And he pointed to my stethoscope a little bit more specifically. So I looked at my stethoscope, I looked at him, and I said, auscultate. So he's like, yeah, but you're a PT. So like, what are you doing with that thing? So I don't remember the exact details of what happened next, because my immediate reaction was stay professional, answer the question, educate. And that's not always easy to do, especially when you can tell there's a tone behind it. This wasn't the same question that the other person asked me. This was like, what the hell are you doing with that thing? You don't have any right to wear that, or at least that's how it felt. So I said, well, I auscultate my patients, and if they have mucus, fluid, or any other issues, I can better intervene with specific breathing exercises and airway clearance techniques. And he just looked at me like I had 15 heads. So I just further asked, is there any updates or concerns with this patient before I see them? And had a decently professional conversation. Saw the patient. The patient actually was someone who needed to be auscultated. I did breathing exercises and whatever techniques that day, and had some vital sign response things. So post-session, I gave handoff. I included auscultation, breathing exercises, and my vital sign response. I was professional. I was taken off guard, but it was an opportunity, right? If you have the skill to do something, don't be afraid to wear your stethoscope. And you might throw some people off, and that's okay. The next story hits me a little bit different because I wasn't involved and I couldn't help. I had a former student who went out on their first clinical affiliation. I shouldn't say that. Went out on their first acute care affiliation. She was super excited for the experience. And on her first day, she was doing chart review with her CI, the usual kind of like pre-morning routine. And as they were about to go up to the floors, she put on her stethoscope, proud and ready to start her day. And her CI stopped her dead in her tracks and asked, "What are you doing? Why are you wearing that?" That's for doctors and nurses only. How freaking disappointing is that? So I heard this story post clinical rotation, and I just felt so bad. One, because I couldn't do anything. Two, because I couldn't speak up for her. And three, what a shit way to start your first day. You're all excited. You're finally going to be able to use the skills you learned, and your CI deflates you. Deflates your profession. Totally trashes your scope of practice. What is that? We have to do better. We have to do a lot better. So just because something isn't your thing, PT is a huge scope of practice. I think it's awesome. But we have to support each other. Because if you're going to trash everything that you don't do or don't like, we're going to have nothing left. And I will tell you for fact that when you don't stand up for your profession or your scope of practice, things start to go away. So stop it. Do better. Stand up for each other. Support each other. Help each other. There are many things I don't do in my practice that other therapists can do or able to do. I'm not going to say don't do that. That's not for PTs to do. Wear the damn stethoscope. And you want to know what? When you do, gives you an opportunity to educate, gives you opportunity to increase your skills, and it gives you an opportunity to do better for your patient. And at the end of the day, that is what matters. I was so disappointed in that moment. sorry, I just lost train of thought because we just have to do better. So my advice is help each other, stand up for each other, promote each other, even if it's not your thing. And if you want to learn how to auscultate, it starts with wearing the damn stethoscope and be proud of wearing it. The only way you get better at something is by practicing. You need reps. So if you want to improve your skills, what I tell my students, my residents, my mentees, wear the stethoscope. Start auscultating your patients. Get comfortable with the routine. Just listen. You don't even have to know what to do yet, but you have to listen. You have to wear it. You have to make it part of your evaluation or your session for that matter. Find yourself a mentor. Take a continuing ed course. And then when you learn how to do the skill that you want to learn, do it, support it, teach other people, educate, but most importantly, stand up for your profession, even if it's not what you do. I feel so passionate about this. That moment I saw red when my student told me this because it's disappointing. We can't disappoint each other. We can't put each other down. Stand up for your scope of practice, do the things, practice the skills, educate, and make it not a thing. So my parting words are, wear the damn stethoscope. I hope this was helpful for you. I know I was on a bit of a tangent, but I feel some kind of way about this. And the only way we can make change is by talking about it, by changing the habits, and by changing the picture. So wear the stethoscope, do the auscultation, make better change for your patients. All right, I hope you all have a wonderful day, and whatever you have to do, get after it.